Well, hello, Mary. How are you today?
I am fabulous. Thank you. Thank you.
Good. I'm so happy we're sitting down to have this conversation. How have you been? Tell us about yourself and what you do with the field of mental health and how you've been feeling lately.
So I've taken some time off due to, knee surgery. I had two
Yeah.
total knee replacements in the last 3 months. So I've taken some time off, which has been actually good for my mental health, right?
Mm-hmm.
And we're always talking about taking care of others, which is what I do professionally. I am a psychiatric nurse practitioner. I've been an RN for over 30 years, psychiatric nurse practitioner for 5 years. And what that means is I prescribe medications for people with behavioral health components, be it schizophrenia, depression, anxiety, post-traumatic stress disorder. I can also provide therapy, connect with community resources. And we get so caught up in doing that and helping others, we forget about ourselves. So taking this time out for my physical recovery has also helped me in taking time off for my mental health also, which I'm grateful for. But I do enjoy doing what I do. I work at the local hospital, Cleveland Clinic, but I also am out in the community. I have a degree in public health also from Kent State, and I love being literally in the community away from the formal institution. Because unfortunately, there's too many people who will not come to the formal institution, and those are the people I really want to reach. Because those are the ones, unfortunately, who are dying the most by suicide, gun violence, and we're finding later after they're gone.
Oh, that's a good point. It's too late by then, and we have to be proactive, have these conversations, and highlight the things that we need to have a healthier community.
Correct.
So I'm so happy that we're having this conversation.
Thank you so much. I appreciate it. I'm honored.
Thank you all. I'm honored. So a question I have always wondered that I really don't think I have the answer to is mental health. Is it the same as happiness?
Okay, it's not. So happiness is a temporary state of being. It's an emotion, a feeling, right? It can come and go at any time or any moment. Whereas mental health is the overall, like it's an overall state of being of like being able to handle the challenges of life. Having the coping mechanisms, the coping skills to be able to deal with negativity. I mean, we all have negativity in our life, right? Mm-hmm. There's no such thing as utopia or a perfect life. So just being able to manage or have the resiliency to deal with the negativity as it comes and goes, mm-hmm. right? To be able to overcome it and to continue on with life, mm-hmm. Without falling too low. Whereas with happiness, happiness is temporary. It's not permanent. We have moments where we're not going to be happy, but that doesn't mean we don't have a good mental health state.
Okay, I see. Very interesting. Do you get asked that question often?
Actually no. But I think unfortunately it seems like in the last, especially since the pandemic, right, since 2019, 2020, it seems like happiness, people feel like it's like so far and hard to attain. Mm-hmm. Being in a positive state of being. It's like, at least here in the USA, there's a lot of sadness, a lot of pain, mm-hmm, mm-hmm. And I think a lot of times, even like the hatred that is going on in our country, that's really like James Baldwin said. A lot of times people use hatred. I love James Baldwin. Yeah, so he'll say that people have hatred so they don't have to deal with their pain, and I think that's a substitute, right? So people have a lot of pain that we're not dealing with.
Yes, this is true.
So our country, we got a lot we need to deal with. That there's not enough providers out here is one problem. Right. There's stigma about providers, and it's not just a minority or black society or Latino or Asian problem. Across the board, there's still a lot of people who think that they can take care of it themselves, or they don't want to process mental health or mental issues themselves.
How that sparks a question in my mind, an additional question aside from our scheduled questions, is do you think that people may not be aware that they have mental health issues and then they don't know how to go about getting help? It's like if you know that, you're having a pain in your back or something, and that alerts you that you need to go see a doctor or someone who can see about that. Mental health, there's not really a physical pain that will signal that something is wrong or that we need to be seen Does that make sense, the question?
No, it
I'm
does.
asking?
And actually, it's a complex question because unfortunately, mental well-being, if we lose that over time, we can have physiological symptoms.
Oh, I see.
We can have GI, like stomach distress with diarrhea, constipation, pain throughout the body, migraines, headaches. So it can cause physiological symptoms over time. It won't be in one day, but over time, the body can only compensate for so long because we're one being. As like the World Health Organization states, health is not just like your physiological well-being. It's spiritual, physical, mental, emotional, and environmental well-being. So we're all one. Like it's so much that makes us up together. And if one is out of like whack, if you will, then the other is compensating, but it's only going to compensate for so long. But yes, so I think the problem is some people don't like to hear the word mental health, right? Or mental health issues, and they don't like diagnosis. So like I had a one patient, she's an older black woman in her 70s. She's like, I don't have a mental health problem, do I? And she loves her meds because they make her feel better. I said, you know what? You just have a life problem. I said, you're a human being who's going through a normal life issue. Yes. And she didn't have issues like in the past. Correct. It's her first time coming for medications. And we've been doing well with the meds, but now she's scared to continue because she's feeling better and she wants to stop because of other people. I said, you're just going through a life challenge at this moment. You're a human being. The medications are helping. Let's continue to let them help for a little longer. Let's implement some therapy, and maybe at some point we can stop them. But this does not mean you are a mental health problem. This means you're having a life problem.
That's a very gentle, compassionate way that you put that. And I'm sure that also helped her mental health to hear that you have such a beautiful opinion of her. Because I think sometimes mental health patients or people that suffer with this, they feel that people think lowly of them, or that they think that they are not good enough, or that they think people are belittling them or looking down on them, and nothing could be further from the truth.
Correct.
Something else you said I want to touch back on about the body's manifestation of the physiological pain that eventually it becomes. How would a person know that the source of that is the mental health issue? Would they know or not?
A lot of times they don't.
Okay.
So a lot of times they're going to a lot of times people don't have a clue. They're actually running to their primary care provider or the emergency room or urgent care saying, oh my God, my stomach is having problems. I'm having diarrhea. I'm having stomach aches, or I'm having pain all over my body, or I'm having migraines that are out of control, or I'm always having like nausea. They don't know. They're just having these physical symptoms. And the providers, a lot of times, they're doing all the diagnostic testing, going through it. They can't find anything wrong, and then now they're like, well, let's check you out for behavioral health. And sometimes when they do an adequate, history, they can say, oh, okay, maybe there is something going on.
Okay.
They're not 100% accurate. Sometimes it could be something hidden that wasn't discovered.
Yeah.
But a lot of times they have learned that our bodies, they get beaten up. The body gets beaten up and worn down from not being able to handle but so much emotional, spiritual, and mental turmoil.
Wow. And then I bet it takes some time to convince this patient that that is the source or cause of it, possibly. They may be in denial about that too.
Correct, because it's easier to accept a physiological, in America, and depending on what culture you come from, right? It can be especially easier to accept a physiological diagnosis, because then we feel like you stated, it's not my fault. I can't help it. It's my body just turning on itself. Where if it's more of emotional or mental, then it's like, what's my fault? What could I have done differently? Instead of realizing that we're human beings, life is challenging, and trying to figure out what can we do to deal with the challenges of life. Because life is more challenging than ever today.
It is.
People are isolated today still. Even though our country has opened back up, people still are within crowds of people, but they're isolated. So being around a bunch of people physically does not mean you're socializing or you feel like you're a part of somebody. Or you're connected. Exactly. There's a problem. We have a disconnectivity in this country. That's a problem that was recognized by the Surgeon General. Loneliness is a public health phenomenon that's going on in this country. And that's even with social media.
Mm-hmm.
There's something.
Social media can be the biggest culprit for
Yes.
fueling the feelings of loneliness and depression and anxiety.
Correct.
Because it's virtual. This person is, are they really your friend? Are
Correct.
they really, they're not really here. It's like a fix. You reach for your phone for whatever social media preference that you have, and it's temporary.
It's a superficial connection, right? It's not getting deep. And like, to get to know someone in a deeper layer, you gotta have that trust. And it's kind of hard to get that trust right through an app.
Correct. Right. Perfectly said. Yes. There's no such thing. Yeah. It can't. I'm already enjoying this conversation very much. So, another question for you. Why is the connection between creative arts and mental health outcomes a discussion that needs to be amplified?
Well, it has been shown, like, they're doing a lot of research, or a lot of research has been done, where they've shown, like, arts, be it music, drawing, building, whatever you want to call the arts, right? It helps people connect with other people. It has helped bring out emotions that people were having difficulty to tap into. It's helped people with identify their emotions, to help regulate emotions, to help like bring in joy, to bring out like happiness. So it's been, and art therapy has grown. Actually, it's at least in this state, you have to have a master's for it. I know there's not that many programs here locally, but it is a phenomenon that is occurring, at least where we recognize, is help patients with cancer deal with their depression and their diagnosis, right?
Yeah, I can
it's
see
not
that,
just in a direct mental health program. It's even in diagnoses that are hard to deal with, that are life-changing for the individual and the family. They're using art to help deal with the outcome, of those diagnoses.
And that's important because, as we were speaking earlier, happiness is temporary, as opposed to the well-being state of mental health. So I think that that's very important that we amplify this conversation, because at some point, I feel it's important to be able to have solid remedies that we can pull from within ourselves. And it has nothing to do with an externality, such as an app or a phone or a computer or anything that requires your electric bill to be paid. That internal bonding is critical to such a process.
And art can be anything. It can just be like dance movements, right?
Oh, okay.
It can be
yeah,
drums.
You're right. Could be.
It can be drums. It can be like, I think we don't have to limit our imaginations to what art is. It can be whatever medium you want it to be. Like, I remember I was at a school with one of my colleagues, and there's a spaghetti program that's actually out on the internet. We picked it up from. We just used raw spaghetti and marshmallows and had the kids. We told them they're architects for the day, and to build whoever build the tallest bridge or tallest structure will win. But that's art. They were creating a structure using raw spaghetti and marshmallows. So art can be whatever you want it to be. It's just creating, and they have fun. They learn how to work in teams, because they didn't know how to work together. These kids were fighting. This is an inner city school in Cleveland.
Okay.
These kids, I was warned in advance. They do fight. They do argue. They were able to. At first, it was challenging, but after about 5 minutes, they learned how to work together in teams.
Wow.
They were doing it. They realized, we can't do this separately. We're not winning, and they wanted to win
all together. Yeah.
They learned how to get. Everyone was quiet.
Wow. So with a project like that, how do you keep it? How do you keep it going? Not you per se, but how do the students? How does someone come together on an experience like that, teamwork, and they previously were not conducive to this type of teamwork? What makes them want to keep going back for more?
So basically, the leaders, right? So with the kids, it would be like the teachers, the principal, right, where the leaders of the school are. And this is a program manager who brought us in. Of a particular program that works with the youth, but they need to continue this practice. It shouldn't just be a one-time thing.
Correct.
Oh, here comes Miss Mary Louise Tatum and her, Mr. Wilson. No, this should be like something like, let's build upon this. Let's do this every single time we meet with them. Because if it's only occurring the one time we come in, then you're right, it's a loss. So this needs to occur repetitively, consistently, so it can be built upon and be a sustainable practice.
And then the students will eventually get the picture
they'll change. They'll condition themselves.
Right.
The brain and behaviors, you can recondition yourself to any behavior, good or bad.
Right.
Good or bad, you can be reconditioned to new behaviors.
And that's the beauty of the way the brain was created.
Correct.
It's such an organic matter. There's no static. It's just what you put into it. It's
God
beautiful.
Created something that's so remarkable that
Yes.
we're still learning about this
The
today.
brain, the transformation
we're
of it.
We're still learning about it, right? We don't know everything today.
It's impressive to think about what we can do together and what we can do when we are mentally adjusted and when we feel loved, when we feel whole, when we feel that we matter. And all of that is vital for mental health.
Right.
Absolutely.
Like the African proverb, you want to go fast, you can go alone if you go fast. If you want to go far, you go together.
I love that proverb.
Yes.
I was just talking about that the other day with somebody. So we were wavelengthening even before I got here today.
Yes.
Yeah, that's good. So from a clinical perspective, what impact does exposure to art have on the brain? We kind of were touching on that a moment ago, but we can get deeper into it.
Yeah, so it can create positive pathways that that changes, like as far as like dealing with substance use disorder, alcohol use disorder, people dealing with Parkinson's disease, cancer, mood disorders, eating disorders, whatever. It can help with like reducing loneliness, facilitate emotional expression, promoting peace and inner peace, right? Which and a lot of times we see bullying and all these behaviors that people have externally, like with each other, like anger and at school, not just with adults, right? We see these in elementary school, kids acting out with each other
at a young age.
At a young age. So we can use art and other activities to help, like, minimize that by allowing them to have maybe an inner peace with use of art, and it can also stimulate the brain's reward center of feeling good. So it's not just gym and activity, like we talk about the endorphins and stuff with activity and exercise. You can get that from creating something. Creating something out of your brain that no one else has created. And you're like,
such an empowering feeling too.
Exactly. It makes you feel empowered. Like I can do anything. There's nothing I can't do. And that's amazing, right? So like for some people, their body is their work of art.
Oh yeah.
Right? So whatever is your work of art, Like today, tattoos are work of art. That's a work of art. So whatever. And also so basically like just creating that sense of pleasure and that sense of well-being. And we just need that. It's like, because I think people are just, like I said, they're in pain, they're angry, they feel alone. It's just, and it saddens me, because I have young people who are like, they say they feel isolated. They don't have friends.
Yeah, and the friends that they're used to having are not the traditional type definition of friend that we understand society to mean today. You go on Facebook, you can have 4,000 friends or 5, but the definition of friend is not that. It's a connection.
Correct.
It's a link, but this person, they don't know you.
Right.
They don't know your middle name, most likely.
Right.
They don't know where you live. They don't know your favorite food.
Right.
They don't know anything about you.
The deeper stuff, right?
Exactly.
The deeper, more like once we get below below the superficial, right? And we're talking about like the feel good, just like the dopamine center, and like having a release of like all that the feel good chemicals out of the brain. That's just like, so I don't run. But I can get a fast walk. And with a fast walk, I can tell you, it's like and it takes a while to get there. You don't get there in no 5 or 10 minutes.
No.
It can take 20 or 30 minutes on that treadmill or out on the pathway to get there. But when you get it, you're like, wow.
I'm so glad you mentioned that, because I noticed that when I am on the treadmill, there's a break-even point where I feel like I can fly.
And you want to go further. You don't even want to stop. You're like, oh, can I get 10 more minutes in? Let me get 10 more minutes in.
But that doesn't happen right away. I notice it comes like after 15 or 20 minutes. Exactly. I didn't know there was a brain chemical reasoning for that.
You're getting a release, and your body wants to chase it. So you actually want to stay on. You're almost like, let me cancel this next appointment. Let me stay a little longer, so I can just get a little longer. And it does push you to want to go a little further.
Yes.
So it is. and you get that from creating with art. So not everyone's the same, right? Because not everybody has that bone of where they want to create, or some people feel like they're not, right? Because they've been put down about it, or they never had the opportunity. So now they need to realize, well, hey, at least in Cleveland, Ohio, we have so many opportunities in institutions where you can take art classes, right? You don't have to go to the colleges. You can go to the art museum. They have opportunities. The Natural History Museum has opportunities. And I'm sure, the libraries, they have opportunities that are free or at minimal cost where you can do different works of art in different mediums. I know they even have a chalk art thing, I think, at the
oh, really?
Museum of
I
Art.
have to look that up.
Yeah, I think in the springtime you can just draw on the concrete and stuff. Get some chalk from the dollar store. $1.25 store, excuse me. And
oh yeah, they did increase it by a quarter.
right. And you can just draw on the sidewalk.
Wow. I'm still taken aback by the chemical release that you just spoke about. All these years, I never knew there was a chemical reasoning for the way I was feeling after 20 minutes.
So you thought it was just you, huh?
I don't know what here. I didn't know what was going on. I knew I felt like a superwoman after, like, whoa.
Yes. And it actually, so exercise can become addictive after some time because of that, right?
Yeah.
And I love it. It took me some years to get into exercising, but once I got into it, I loved it. And
I do too, yeah.
Yeah, I mean, it saddens me that I'm temporarily down because of my knees, but I'm coming back.
Yeah.
I came back after the first one. I'm coming back after the second one.
The
Girl,
got six knees.
Look, let me not curse myself. Second knee.
Either you have to have 4 more surgeries,
girl, no,
or you have
I'm
six knees.
Be the bionic woman for real.
That is so true. Oh my goodness. So what do you want to share with us that you're doing next? Like, what are your impending goals? I just feel like everyone needs to know you. I think you just need to do a workshop in every continent, like every community, everywhere. But you are in several other continents anyway already. Some countries. Yeah.
I've been blessed to actually teach at the University of Zambia, nursing students in Zambia, and I would love to go back actually to work with mental health in that country because it is a problem. I have several friends, and they're not my blood family, but I call them family that are still there, and it's a problem, right? There's few resources. So I would love to go back there, but I also recognize I am American, and we do have still an issue here, especially in the rural. My family's originally from the rural South. There's a problem here in the rural areas of healthcare, period. Not just mental health, but period. Healthcare is an issue. So I'm praying to be able to expand on providing services with that in the future. So those are some of my goals, long-term goals. Short-term goals is just the kind of, I want to get my doctorate. I applied for a doctorate program at Johns Hopkins. So we'll see if I get in or not. I'll know by next year, March.
You will.
Yeah, so I'm
You're
praying
already
for that.
there.
I know I only applied for one program, so it tells you my ego is a little there, right?
And deservedly so. You are phenomenal. Deservedly so.
We'll see. And right then, I love working in the community. So I do work a lot with the Barber College in Mayfield Heights. There's a Barber College, La Barberia. I work with a couple of the barbers in the community. And I would like to continue to expand on that program until, for the short term. That's my short term, is to work on in the community. I want to work with adolescents more because I think the younger you go with making change, the better it is, right?
Oh, yes,
why
true,
wait till people have already experienced, more abuse or being in prison or in jail or trauma? The younger we can reach people, the better.
Yeah, I agree with that. Makes a lot of sense. Well, I have thoroughly enjoyed our conversation. I've learned a lot, and I'm sure others listening have learned a lot as well about mental health, happiness, the little things that we can do day to day. They don't have to be large things, but little things.
And just love
investment.
You.
Yeah,
love you.
Yeah.
Regardless of what anyone else tells you, love you.
Definitely. Thanks, Mary.
Thank you. It was a pleasure.
Okay.
Thank you.
Bye-bye.